Alright, this is a video trying to explain my quality assurance plan. The purpose of my quality assurance plan is to develop a systematic and continuous protocol for assessing the patient care delivery system. It's just going to be going over the hygienists, dental assistants, and dentists, and everyone that is part of the team in the office to make sure that they are going through with the protocol and the assurance plan to make sure that everything is going smoothly and going well. So the main thing in my quality assurance plan is charting. Charting is very huge in dentistry and it is upholdable in court, so it is a court document. So I will have chart audits quarterly. There will be specific requirements for adult charts and pediatric charts. So the adult charts have certain requirements, and I'll list them here. They need their medical history stated, and then it needs to also say in the chart that the medical history has been reviewed. There also has to be an approval note that it was read and approved by the dentist. It has to have the patient's chief complaint of what is bothering them, and also a pain scale from 1 to 10, and put what pain scale they are on, 10 being the worst pain ever. Also, it needs an intraoral and extraoral exam performed and documenting the findings. They also need to document the hard and soft palate findings. If there is a treatment plan that's gone over, that needs to be documented. Vitals need to be recorded once a year unless otherwise stated or needed. And also, radiographs need to be completed once a year and in the chart unless otherwise needed. Also, any medical issues or medical alerts need to be updated every time the patient comes in. If there is a change in medications or any diagnosis, that needs to be updated in the chart every single time the patient comes in. There also has to be completed periodontal charting once a year, so that's periodontal probing that's required once a year in this office. Also, all materials that are used during the procedure need to be recorded. And if any medications are prescribed, that needs to be documented in the chart and the dose of what is being prescribed. For children, the chart notes it's a little different, so they need parent or guardian consent in the treatment plan. Also, it needs to state that the medical history was reviewed with a guardian, and also an approval signature by the dentist. It also has to have the patient's chief complaint and also the scale of 1 to 10, pain scale, 10 being the worst pain, an intraoral and extraoral exam, and the findings charted. And blood pressure is only if needed by the doctor, it's not required. Radiographs are going to be taken according to the ADA guidelines for children, so that's about once a year. There needs to be medical history updated every single time a patient comes in, and it needs to be stated that it's gone over with by the guardian. And if any medications are prescribed, that also needs to be stated in the chart and the dosage. And also, if any of the child's permanent teeth are coming in, or if they've lost any of their primary teeth, that needs to be charted. So for radiograph processing, the testing for film processing, the light leak test. So you need to go into the dark room, turn off all the lights, and once your eyes have adjusted to it being completely dark, you need to look around and see if there's any light leaks. If there are light leaks, then they need to be fixed immediately before film processing. You can either use weather stripping or black tape in around the door or any areas around the ceiling that need to be fixed. If there are no light leaks, you can continue film processing. For the automatic processor test, you need to prepare film. So you're going to take 2 unexposed film and expose 1 to light, and then leave the other one non-exposed to light. You're going to process both films. So if the processor is functioning, both films will come out clear or dry, but the unexposed film appears clear, and the film exposed to light will appear black and dry. So you can proceed with processing if these results come. And if the processor isn't functioning, then the unexposed film does not appear clear and dry, and if the exposed film appears completely black and dry, then the processing temperatures and solutions need to be looked at and changed before you continue with processing. So I have a chart in my assurance plan that looks like this right here. And what I have stated in it is dental x-ray machines. For quality control tests, they need to be done yearly. For the dental x-ray film, to rotate stock, you only need to rotate stock when new film arrives. Also with the fresh film test, that only needs to be done when new film arrives or when a new box is open. The dark room, the light leak test needs to do monthly, and that's the one that I was stating with the weather stripping or the black tape. The safe plate test has to be done every 6 months. For digital imaging equipment, so the computer data backup needs to be done daily. This is to save patient records. Sensors need to be done with frequent inspections in case any of the cords are broken or anything like that. Imaging plates need to be done with frequent inspections, and wired attachments need to be done with frequent inspections. And that is my quality assurance plan in a nutshell. I hope you guys enjoyed.